Hi, my name is Renee, and I'm here to walk you through how to use the products in the Willow Find Your Flow feeding kit. Finding your flow in the early days means taking care of your breasts and addressing issues when they arise. Not only will this make feeding more comfortable, it'll help you maintain your supply and set you up for long-term feeding success. So, we're here to tackle some of your most pressing questions on all things engorgement, clogged ducts, and nipple pain. We'll talk about when you're most likely to experience these issues and share some tips for treating them and getting help from your lactation consultant or provider. There's unfortunately no way around it. As you establish your supply, conditions like engorgement, breast and nipple pain, and plugged ducts are all pretty common. Now let's dive into some of the questions we receive most frequently from moms who pump with Willow. There are a few situations that could lead to sore nipples: frequent feeding with a poor latch, frequent pumping with an ill-fitting flange, or a combination of both can all lead to sore nipples. In the first couple of weeks, it's totally common for your nipples to feel tender or uncomfortable when you begin pumping or feeding. This pain should resolve within a minute or so. First, take a breath. Sometimes your nipples just need a minute to adjust. If you've done that and you still feel discomfort, try to reset your baby's latch by using your finger to break the suction, reposition them, and relatch. The goal is to get a deeper latch with their lips flanged out and as much of the areola in their mouth as possible. If you're pumping, this is a time to measure your nipples and check you're using the flange that fits. Sizing up or down or adding an insert is one of the easiest ways to soothe this discomfort. You can use the Willow sizing guide or cloth measuring tape to measure your nipples. Also related to pumping, you can try to decrease your suction level and see if that helps. There are a number of at-home remedies and products that can help address soreness too. A warm saltwater soak is a research-backed method proven to soothe mild or moderate soreness and takes just a few minutes. To make it, mix half a teaspoon table salt with 1 cup of warm water. Soak your nipples in this mixture. Shot glasses are great for this. Gently pat dry your nipples and apply nipple balm. If you're dealing with moderate pain or blistering, gel nipple pads can provide immediate cooling and soothing relief. To use them, place the gel side of the pad over your nipple. Wear until your nipples feel relief. You can reuse them for up to 24 hours. For severe pain, which might look like wounds that are open, crusty, or oozy, silver nursing cups are designed to provide antibacterial relief. To use them, apply a few drops of breast milk inside each cup to help them adhere. Place the silver nursing cups over your nipples and put on your nursing bra. Just a reminder, don't use any balms or creams. If your pain is ongoing, or if nipple wounds appear or worsen, then it's time to get help from a lactation specialist, since this could be a sign of something more serious. Engorgement describes breasts that are swollen, tight, or warm to the touch. It usually occurs a few days after birth as your milk comes in, but it can really happen whenever more milk is being produced than removed, like when you're struggling with latch, so milk isn't being properly drained, or when your baby starts sleeping longer stretches, or when you begin weaning. Breastfeeding or pumping is the simplest way to try and get relief. But if your breasts are too taut for your baby to latch comfortably, you can try a few different massage and expression techniques. First, try gently massaging your breasts in an upwards direction towards your armpit. Keep your touch light. It should be like you're applying lotion. This can help soften them and work through any plugged ducts if you have them. You can also try a technique called reverse pressure softening. Gently but firmly press the base of your nipple. Drag your fingers across your breast tissue. Repeat, starting at different points around your nipple. If you need more assistance, a lactation specialist can help you perfect this technique. Beyond massage, you can also try hand expressing some milk to soften the areola and nipple enough for your baby to latch. Or you can try pumping for a minute or two. If you choose to pump, make sure to keep it quick. Pumping for too long can signal the body to make more milk, which can make engorgement even worse. You can also try to apply cold packs or cold compresses, like these included in your kit. An anti-inflammatory medication like ibuprofen can also reduce swelling, but talk to your doctor first about the right dose for you. You'll want to get in touch with your healthcare provider if you try these tips and don't get relief. If you have a fever above 100.4 Fahrenheit, if your baby doesn't seem satisfied after a feed, or if your breast develop redness and lumps and you experience fever or other flu-like symptoms, which might be signs of mastitis. Plugged ducts are a common side effect of breastfeeding. These small, hard lumps usually occur in the first 6 to 8 weeks and can result in swelling and discomfort. If you can, try and track your symptoms when you first notice the plugged duct. This is because plugged ducts can lead to more serious conditions like mastitis or breast abscesses if untreated. Knowing how to recognize the look and feel of a plugged duct can help you get ahead of a more serious issue. It'll be the size of a pea or a little larger, it'll be firm or lumpy to the touch, and it'll likely feel painful or sore. Sometimes they're also red in color. Just like with engorgement, you'll want to continue breastfeeding or pumping the breast that's affected. Try positions that point your baby's chin toward the plug to pull on the affected duct. This is also time to assess your baby's latch and take extra care of your breast. To help treat plugged ducts, you can apply cold packs to reduce swelling. Also, avoid tight clothes and underwire bras that can further constrict milk ducts. Go topless and braless when possible to let your breasts air out and prevent bacteria from thriving. Regularly wash your nursing bras and tanks. Gently massage your breasts in an upwards direction towards your armpit, just like you would if trying to relieve engorgement. You can also try using a vibrating massager like the Levy Warming Lactation Massager, which has a narrow tip for more targeted massage. If you try these tips and are still struggling, don't be afraid to ask for help. You should get in touch with your lactation consultant or healthcare provider if you have any swelling and pain that doesn't subside within 12 hours, or if you develop a sudden fever above 100.4 Fahrenheit, or if plugged ducts keep reoccurring. Let's recap. While these conditions are common, you don't need to live with them. Start by addressing the root cause, which is usually an issue with your latch or insufficient emptying. Remember not to stop breastfeeding or pumping. That'll likely make things worse. And finally, treat your pain. There are products and techniques like massage that can help. A lactation consultant can also help you turn things around, so don't wait to get help. Let's do this feeding thing together.